Thank you very much. I'm so happy to be here. Before I get started, I want to appreciate and honor the previous panelists who have shared so much important information. And I know that everyone, all the participants will benefit from the hard work that they've done and the great messaging and great communication endeavors in place by the Department of Health. Next slide, please. So thank you for that, everyone. Here we are with just the update. By the end of the module, we'll be able to talk about the context of what's going on with misinformation and disinformation in the public space around COVID. And we'll talk a little bit about how the Department of Health addresses the negative perception and also high traction negative statements. Some of the preceding panelists have also discussed a bit of that in terms of social listening and things like that. So we'll also talk about what and how to report on communication around the COVID-19 vaccine, which has a lot of interesting perspectives and characteristics that we haven't seen in the past vaccine environment, only because we focus on tend to focus on routine vaccinations, and here we are in a totally new world with COVID-19. So we'll also talk about how to establish and promote a single source of truth on the vaccine, because there's so much misinformation and disinformation in there. We're going to talk about a little bit about how to address that. And we'll describe how to communicate about adverse events following immunization. We know straight away, we need to be honest and candid. We know we'll have some adverse events associated with this vaccine. Already we're seeing a bit of that in terms of reporting, but the bottom line is no vaccine is 100% safe for everyone. We'll talk about key messages and effectively communicating about AEFIs. It's a super important topic. Just kind of a quick recap of where we are on the human scale. We're experiencing the greatest public health challenge in more than 100 years. And we're seeing firsthand that infectious disease knows no borders, that countries are taking specific actions to protect their populations, and regions are doing the same, but we're all in sort of uncharted territory in terms of understanding cross-border implications of a pandemic of this scale. And we're dealing with a virus that's caused the death of more than 1 million people across the globe. And it's almost hard to get your head around that number of people. So with all those things in mind, the world needs the important work that you do as communicators, as health promotion officials, in all these environments that are supporting the communication efforts associated with this outbreak. The world needs you. This is a quick, just a quick diagram of the emergency life cycle that we talk about in communications when WHO and leads trainings for countries to help them put together risk communication plans. We sort of see the preparation, response and control, crisis mode, recovery and evaluation. Well, as you all know, we're living through every single phase right now, because everything associated with the vaccine rollout, the preparation for it, the preparation for the crisis mode when there are AEFIs and how to respond to them on a communication level. And then we're constantly evaluating what we're doing and incorporating lessons learned to reevaluate and restart where our planning goes and what exactly we're doing on a day-to-day basis. I think it's useful to see this in the context of the work we do every single day, just to sort of see that it's not always a linear 1, 2, 3, 4 situation. These things, the colors blend, the timing overlaps, but at the end of the day, we're doing all of these things at the same time. Okay, so talk again just quickly where we are. I know that some of the previous panelists have touched base on this, but we're in a place now where the vaccines are available. There's been a lot of conversation about the vaccines before now. When are they going to be here? What are they going to look like? What's the distribution going to be? So here we are, they're available. They're coming to the Philippines, being here soon. And we see from other country experiences that we've got AEFIs and side effects already in place, some very severe, some not so severe. And from a communication standpoint, of course, our goal is transparency and accuracy. And so we're clear and very transparent about the issues associated with AEFIs and side effects. And the development of new strains, I know I've seen a couple of mentions in the Q&A about, do we know if the existing vaccines, how is it going to address these new strains that are being showing up suddenly? And then also there's multiple vaccines in development. And so some of the other panelists have talked about, people will ask, I prefer one vaccine over another. People will ask, I don't understand some of the technology being used to create these vaccines. And so the messaging associated with these things is very, very critical and very important, because people need to know. I mean, we know in risk communication, the goal is it's a two-way conversation, but the goal is fundamentally to help people make informed decisions to protect themselves and their loved ones. Our role as communicators is to give them that information to support them in making those informed decisions. We know from research that the behavioral drivers of uptake are there. We know that an enabling environment is the first, social influences, and motivation. An enabling environment means that it's convenient and easy for a person to go get the vaccination, whether it's location, time, information, quality of the experience. And this can be as much as the person who invited me to go get vaccinated was kind. The person who invited me to get vaccinated, the health promotion person who talked to me about vaccination was honest and was answered all my questions. And there's a lot of humanistic conversation that goes into informing a decision because of the quality of the experience and the quality of the experience with you. And the social influence and the responsibility that we have as communicators is to aim toward establishing vaccination as a social norm, so that people will encourage each other. And we know from the data also that when people are in that supportive and encouraging environment on most any topic, they're more inclined to approach, to join that community. And so again, also motivation. What motivates people? They're the people in the community that they trust, health professionals advocating for the vaccine, and also the trust that they feel from other people, whether it's their leader from church or other stakeholders who have an influence over them. And one way to motivate people is to emphasize the social benefits of vaccination. We're all in this together. And so getting vaccinated helps you, helps keep you safe, but also helps keep our community and our country and our world safe. Next slide, please. Okay, so I'm sure that people will ask you this, or already are, why should I get vaccinated? And so again, like the message I just said, getting vaccinated keeps you, your family and community healthy and safe. And then the broader economic picture about when you get vaccinated, the more people that get vaccinated, we hit herd immunity, we move to what is the new normal, and the economy and life as we know it will move to a place that's a little bit more recognizable. And ultimately, vaccines are going to be a tool to help bring us to closure in this pandemic. So improving vaccine acceptance, we've seen some plans for that from some of the previous panelists. And what does that really mean on a practical level? You tailor your messaging to your audiences, of course, you guys know that. And you explain the benefits of getting vaccinated, which we just talked about. But we also, I think when we talk to people about getting vaccinated, instead of talking about the pharmaceutical companies and things like that, we see a lot of messaging about this vaccine or that vaccine and this manufacturer. It's important also to talk about the people behind the vaccine. You can throw data out all day long, but if you start talking about the scientist who's producing that data, the people who are behind those numbers, it makes people feel more connected to what's going on, and it doesn't seem quite so alien and overwhelming. Numbers are one thing, people are another. And so when you talk about vaccines to people, reference the scientists, the researchers, the medical experts, and support that data so that you will help people move to a place where they can have a sense of comfort level with getting vaccinated. And when you talk to people about getting vaccinated, again, remember that don't use judgmental language. Remember that people, it's okay to ask, and people have justifiable reasons for wanting to be concerned about vaccines, wanting to understand deeply how they work, what their side effects are, what are they going to mean in just the larger context of life. And I think a lot of times we say, what, here's the data, why can't you understand it? Of course you should get vaccinated. But we have an opportunity here to teach people and to build languages and build champions by using the language that we select. So I always like to think about this as saying, you know what, somebody who is asking is somebody who wants to know. So it's okay to ask. And in responding, you have an opportunity building that champion by listening, doing active listening, and responding in a way that's respectful and honors the different beliefs that people have. Next slide, please. It's important also to proactively explain side effects in any conversation that you have. We know side effects are going to happen. We're committed, as in our communications, to being open and honest and transparent. And we know that there are going to be side effects. And if people expect them and anticipate them and know that we're being transparent about the possibility that they may experience them, we're building trust already, but we're also preventing people from making assumptions. Like if you are showing side effects that are similar to flu, people may think, oh, I just have the flu, and not necessarily continue to practice prevention measures and things like that. And people, if they get the vaccine, they may not feel well, and then they think, oh, the vaccine is making me sick, when of course the vaccine isn't doing that. So other panelists have said, emphasize the side effects, mean that you're having a good immune response. They typically are short-lived, and it's important to return for the second dose. I think a lot of times you may be seeing this with people in your community saying, well, I'll be good with just one dose. Or if the first experience of side effects was unpleasant, they're not motivated to continue with the second dose. So that's an important message to deliver too. So we're changing the conversation of COVID now to the vaccination. We're moving from the prevention measures, which are still in place, and then adding another layer of information that people have to process. And people process information differently in a crisis and under pressure than they do when there's a risk. So when we change the conversation to one of safety and comfort, we're better likely to reach people and help them get our message. So in this case, we'll focus on the benefits of prevention measures and vaccination, because as we know, a lot of people think they just get vaccinated and then they throw the mask away and it's time to carry on with normal life. And of course, that's not true. So people who are skeptical emphasize that the science is clear. These prevention measures save lives. And right now, the vaccine is data showing that it is safe. And don't expect that people are going to take action just based on because it's good for them, because you say it's good for them. Again, there's the trust building aspect of this. Speak also to the consequences of not taking measures and not getting vaccinated. We're again experiencing growth still, explosive growth in the number of cases around the world, and the vaccine is showing itself to be highly effective. Be careful about letting politics or partisanships slip into the messaging that you have about the vaccine. There are many other things to talk about. Politics and partisanship have no place in conversations about public health. Speaking of politics and other things, let's talk quickly about how the dengue crisis in the past informs what we're saying today about vaccines. So a little bit of background, here's what happened. I'm not going to read it because you know better than I do exactly what happened, but the long and the short of it is that trust was severely, severely damaged in all vaccines, in routine immunizations, and just across the board, people's trust was so undermined that we face a situation now where everything that we say about this COVID-19 vaccine, somewhere our conversation is being colored by historical events, and that's always the case. What can we learn from this experience? Well, we see what happened. Trust was shattered, and people didn't know who to believe. There wasn't really a coordinated message and conversation that was open and clear to people. And people weren't really maybe notified that there were possible side effects, and the scientific processes and procedures maybe weren't described. There are a number of different things go wrong, and it was sort of a perfect storm, wasn't it? So at any rate, these are the things that we can learn. And the bottom line is that strengthening risk communication strategies and building trust are the key to not only encouraging vaccine acceptance and demand, but also maintaining trust with the communities who count on you for accurate information. This is just a sum of what I just said, that the perception of vaccines now is impacted by what's happened in the past, and hesitancy is often powered by fear, and fear is a powerful emotion. So as communicators, we also have to factor in the social behavioral construct in terms of the language that we use. Quickly, here's we're going to run through these. Infodemic, you've heard that word. WHO has been using that word a lot in the terms of this outbreak because there is an epidemic of information. There's so much information out there and it's spread so easily through social media that frankly, people have a hard time knowing what to believe. And this is where trust comes in. You want them to believe you. So open, honest, trustworthy. And the infodemic management is WHO is organizing, has organized teams of people that are working to produce infodemic management and applying evidence-based interventions. So responding to rumors, to misinformation, to disinformation in a very strategic and data-informed way. You probably know this, misinformation versus disinformation. Disinformation, they both require action. Disinformation often requires more aggressive action only because it's got a goal behind it of manipulating or deceiving others and therefore burying the truth. And unfortunately, it's easy to produce disinformation nowadays. Everyone has a camera. People can easily Photoshop things. So suddenly you find yourself in a photo saying something that you didn't say or that you didn't mean, and needing tools to actually correct that information. So we're dealing with a lot of this right now, and it's the great social listening and other activities being done by the Department of Health are excellent tools to help you figure out which is which and how to address it with proper messaging. This is an example of one of the WHO Mythbusters. The Mythbuster website, if you Google it, you can see it has great little cards where they address some rumors that are prevalent, that they've determined are prevalent through monitoring of media and monitor social listening. And you'll see in all of these, if you go to the website and look at them, like in this case, garlic is a healthy food that may have some antimicrobial properties. This is an important thing to notice, that instead of just saying there's no evidence, right, going straight into the aggressive no, this response is couched in something that acknowledges the thread of truth about garlic. Garlic is a healthy food that may have some antimicrobial properties, right? So you've already said to the person, you're right, garlic can have some healthy properties. So you've given that person a chance to save face, to not totally be discounted in what they believe, but you then deliver the truth. So you allow the person to save face in the conversation and also provide them with the truth. I think that that's an important approach to consider when you go out and speak in your communities. We just talked about this. Why are misinformation, disinformation dangerous? We all see it. The stakes are high right now. The vaccine coming up, the misinformation, disinformation about the vaccine, whether it's produced by people who have a economic gain associated with one of the vaccines over another. But the long and the short of it is they pose major public health risks and ultimately put people at risk. And if they're not managed well, diminish trust in the agency. So when you're trying to sift through all the information that you see, you can assess the potential consequences. From a prioritization standpoint, you might hear a rumor that's minor versus a rumor or misinformation that has the potential to stop people from seeking care or really set themselves up to be in dangerous situations. Give people prompt and accurate information and show empathy, right? I can see why you might believe this is true. I can see how that might sound right. And then be able to transition from there into the message that you want to deliver that's prompt and accurate. Best response is education, and denying rumors or misinformation without working to correct them. It sets you up for failure. People are going to look to fill that void, and they will fill it with information that may not be correct. And you will have missed an opportunity to actually guide the conversation back to the information that you want people to have. So when you're responding to a message that you know is wrong, these are sort of 3 steps to craft the response. State the facts, mention the incorrect information lightly, explain why that information is false, and then repeat the correct information. People remember the first thing you say and the last thing you say. So these are the ways to speak about these kinds of things and organize your thoughts to design a message that will help debunk a myth or misinformation that you encounter. The media is an ally in fighting misinformation, and we need them to be involved. And so now you should be having relationships with media already in place, that you're building trusted relationships with them. They can know they can count on you for accurate and speedy information when they're on deadlines. And what do reporters want? Reporters want timely answers to their questions. They want to have someone expert to talk to, and expert information coming from that person, and visuals to support their news stories. They also want us to respect their deadlines. It's a competitive business, the news world is, and getting information delivered on a deadline is important. And for us, it's important for us to honor that. They're our colleagues, they're our champions if we treat them well, and we're we want them to be delivering that message to their audience in a way that they know their audience will understand. So health promotion and education officers and information officers, that's you. You are at the forefront of risk communications. You are on the front line. So health promotion and education officers, you know what you do. You lead risk communication and community engagement planning. You align your holding statements and key statements, key messaging, and you serve as the source of truth. The truth about the vaccine deployment and the demand generation is coming from you. And you're babysitting misinformation and disinformation through the tools that the Department of Health is providing for you through social listening channels, through many of the other communication initiatives that they've got in place. Information officers, you guys are right there together, developing accurate and timely press releases. The whole circle of communication runs between these two critical tasks and critical people performing these roles. So information officers, again, are serving as fact checkers, making sure that the information that's handed down is accurate and clear, and partners with the Department of Health in promoting the single source of truth, keeping the message consistent, speaking with one voice. These are critical, important tasks, and those of you who perform them, I lift you up. Okay, let's talk quickly about how the Department of Health is responding to misinformation. They hold virtual press conferences, have media fora, learning sessions, of course, press releases and statements, advisories and updates to keep media informed, to keep people informed, FAQs and coordination meetings, and then there's some great updates on the website. So don't miss that, and be sure to stay on top of the evolving situation on the website. There's the link. Talked a little bit about this earlier, one of the other panelists, about what social listening looks like. And you could see in the presentation that it's a very complicated and very, very data-driven process. So the DOH process actually ends up monitoring through social media, monitoring through other social listening, amplifying the correct information, and tracking rumors. And in doing so, being able to identify what needs to be addressed and amplifying and correcting that information. And also guiding the development of proactive messages. Not everything that we do has to be reactive. Let's talk just quickly about vaccine communications, because the vaccine's coming, people are understandably concerned. And so your role is to accept and communicate uncertainty, right? If we don't know, we don't know. And we gain nothing by setting people up with expectations of something that we don't know. So be candid, be honest. If you don't know, say, I don't know. And when you get the information, if you have the opportunity, go back to that person and say, here's what we know now. Respectful and mindful of public values and concerns. There are a lot of them, and being sensitive to what they are and being able to respond accordingly is important. And part of that is being transparent about possible risks, including adverse events following immunization. So if people know that they can expect there to be some side effects or things like that, as we talked about earlier, that proactive communication, they're better able to cope with it on a personal level. And we're going to have to keep banging the drum and repeating the message about people continuing prevention measures even after receiving the vaccination. That's going to be a big challenge going forward, because people are so tired of social distancing and mask wearing and some of these onerous prevention measures. Vaccine messaging basics. We've got to use every tool we've got to stop the spread of COVID. and people concerned about safety and efficacy. Safety vaccines gone through every kind of test, even though it's been on an abbreviated timeline. No step has been left out. The vaccine is proven to be safe. And there are different types of vaccines, different technologies being used. And it's important to know those things to be able to explain them. And then again, encourage people to carry on with the prevention measures that are important. Okay, here's a quick message mapping exercise about, is the COVID vaccine safe? You guys have probably done message mapping in the past, but the key message for fact one is COVID vaccines are held to the highest safety standard. And then the supporting messages. What does that mean? And key message number two, getting vaccinated is less risky than getting the disease itself. And then the supporting messages underneath it that say very clearly, there can be side effects. No vaccine is 100% safe. And then key message three, COVID remains a threat, right? And what happens because it's a threat? It continues to spread and borders are being closed. So when you think about how to respond to, is the COVID vaccine safe? And you're performing key messages, you can organize them between what we know, what we don't know, and what we hope to know. Or you can organize them just based on what you know is circulating in your community. And the Department of Health puts together outstanding key messages that you have access to. So be sure to refer to those and take advantage of them. Communicating with vaccines and communicating with so many other risk communication topics, it is so critical to start from a place of empathy, to accept that people may have concerns and honor it. When you start at the beginning of the conversation, assume that people want to be vaccinated. Don't start a conversation by saying, well, you probably won't like this, but it's better to say, okay, well, when are you thinking that you'd like to get your vaccine? Or have you considered getting a vaccine in a more positive way? And then you respond to their concerns, and then you conclude the conversation about the vaccine on an encouraging note. Even if the conversation has not been pleasant, the conversation can still end on a good note by saying something like, well, I'm always here if you have other questions. I'm always here if you have, if I can give you more information, you just let me know. Or if you change your mind, let me know, right? So you want to leave that door open for people to ultimately come to you and accept the information that you're giving and hopefully get vaccinated. Burning questions. We've seen some of these in some of the earlier presentations, and these are the questions that I'm also seeing pop up in the Q&A chat box that we need to know, that the information is there and available to you, and it's things that are important to know and important to respond to when they're asked. One of the other panelists showed a very, very, very strategic, organized way in how groups and sectors are prioritized and how the process is intended to be carried out. And a lot of planning has gone into this and organization, and it's really astonishing to see all the moving parts come together so gracefully. Another burning question is access. When is it going to be here? We talked about this already. One of the other panelists said it's going to be free. And the different elements that we have here associated with access, who has access? There may be conversations that are misinformation about prioritization and who's going to have access based on a geographical distribution, not because of the priority groups necessarily, but because of a sense of disparity or inequity between the distribution of and access. So be aware of that when you're in your communications. Okay, let's talk quickly about interpreting the data. You may see something pop up on Facebook or on social media that says, like, the data said there was a research story that came out. Pay attention, because not all studies are reliable. They're not all created equal. And oftentimes they're organized in order to produce a specific result that is important to one person or to one group, but that isn't necessarily accurate. So these bullet points are some things to consider that are warning signs of an unreliable study. And there's so many good studies out there, but there's so many studies coming quickly. It's it takes some sifting through and to really understand what we're looking for and what constitutes a reliable study. So bear that in mind when you see data associated with a study that coming from a group that you've never heard of before, or a researcher that's, for example, an ophthalmologist writing about a virus. Well, ophthalmologist isn't really probably a good source of information in that regard. No offense to ophthalmologists. Okay, this is the same, in the same vein. What does it mean? What do you need to know when someone says, well, the vaccines, this report says the vaccine has 95% efficacy? People are going to want to have a little bit deeper explanation for that. So be prepared for that. And be prepared for all of these questions, how to weigh on the scales, the value of a study that you see, and pay attention to how the vaccine results would compare with the trial results, and why would they be different. So you've got to use some critical thinking when you look at vaccines, and use them to inform your communication. I'm going to wrap up here with a couple tips. Understand the trials and research and their scope and limitations, and be wary of announcements on scientific data made online or by press releases. There are people who produce press releases, they're marketing tools in a lot of instances. Sometimes they have great information, but you have to observe them critically. Don't take them all as exactly the gospel until you've done your research behind them. Great thing to do is build a network of reference sources. You may already have one that helps you look at the data and kind of analyze it. The data is changing so quickly that keeping an organized network is really, really important. Just as we said earlier, not all studies are created equal, and unethical researchers may conduct an analysis of study material that they have deliberately slanted to produce the response that they want, whether it's that they want to sell a product or they want things to look better than they actually do in real life. And this is called p hacking, only because in epidemiology we have the p value associated with scientific research. And so when you p hack, you're hacking that value to make it work the way you want it to. Again, this is more what we were just saying. Where does the study fit into the big picture when you see study data to inform your communications? And this is at every level, not just this is even at the consumer level. When they read about a study on Facebook, or teaching people how to critically evaluate information, whether it's from research or from a study that's reported on a news outlet. This is an important task that we all face right now as communicators. How do we fact check? This is just a couple of quick bullets on things to look for to be sure that the sources that are informing the information that you're using are reliable sources and are accurate. And people do that by seeing, is the information new, who is supporting it, peer-reviewed journals, other credible sources. Okay, let's talk quickly about communicating about adverse events. These are like four categories of adverse events: vaccine reaction, which is caused by some component of the vaccine; a program error caused by error in preparation, handling, or administration; a coincidence, something happened that's totally unrelated to the vaccine after the vaccination; and injection reaction, sort of caused by anxiety about the injection. Communicating about these is important, and knowing the difference between them is important, in the sense that we don't want to establish a situation where people say side effects with no context, or AEFI with no context. So the research goes on, and as some of the other panelists have noted, there's processes for evaluating AEFIs. This needs to be reinforced to the public in your communications too. Next up, these are some things you know about AEFIs. These are things that we talked about before in earlier presentations too. So one thing to remember is opposition and distrust in public services cannot be ignored. This needs to be met head on with accurate information, and again, reinforcing trust. This is the driving factor in all of these. And again, the media is a partner in helping you do this, and engaging them will go a long way in building trust for immunization. I think these technical components were addressed in some of the earlier presentations, but I'll zip through it quickly. The Department of Health's National Epidemiology Center coordinates with the Food and Drug Administration and the EPI program to handle the AEFI monitoring and surveillance processes. And here's how this process goes. I'm not going to walk all the way through it because you can read your own self, but you can see that it's a process. It's a delineated process. It's not arbitrary. These evaluations require a lot of people and a lot of different moving parts, and there are strong structures in place to pay attention and to monitor, respond, and take action accordingly. Here's what health promotion and information officers do, right? They identify the trained point, Review the existing communication plans, update accordingly, ensure that communication remains a key component of any investigation tasks, right? We need to be sure that we're on top of what's going on the technical side so that we can explain it clearly, okay? Information officers paying attention to laws and organizational policies. Assess the capacity for social listening and rumor monitoring. This is super important, as we talked about earlier, the disinformation, the infodemic. We all have a role to play in terms of managing that. And develop your communications plan. Adapt as you need it. Inform it with what you know, with the research that you do, and with the information you're provided from the Department of Health. When there's information about an AEFI circulating, contextualize it, coordinate with the Department of Health's Communication Management Unit and the Health Education Promotion Office at each of these different respective levels, and get an idea of what's going on and get the correct information to be able to share it. How do we communicate when there's already an investigation outcome? Because we have a touchy situation, don't we? If we have a situation that's not related to immunization, we have to contextualize that some AEFIs are just simply coincidental. Maybe it's an elderly person who had a pre-existing condition, and something happened to that person that wasn't related to the immunization, but the timing of it suggests that it was. Well, there are certain steps that you can do listed here to use an opportunity to emphasize to stakeholders that you're paying attention, these are being reported, and that vaccine recipients, people are paying attention to them and monitoring them and ensuring to the best of our ability that they are staying safe. And just reinforce that it's not necessarily, AEFI is not always related to the vaccine. Okay, there may be some operational aspects if there's an AEFI. For example, was the vaccine administered correctly? Was it, did it arrive? Did it maintain its cold chain? What exactly happened? And this will be, the information that you share will be informed by the data that you receive, and you can inform people of the corrective action that's undertaken, some of the evaluation processes that are in place, and how you're making improvements to prevent the same thing from happening again. Okay, this is rare, but sometimes an event is related to defects in the quality of the vaccine itself, and the product may be suspended. And if the product is recalled or suspended, it's important to be candid about that. But again, to use this as an opportunity to reinforce just how closely these issues are being monitored, just how closely that we are paying attention and being responsive to information and to activities and incidents as they arise. Okay, when things are unknown, we say, I don't know. And sometimes an AFI will occur and we don't know what the issue is. And we have to say, I don't know. And we can reinforce that and couch that with the fact that other people have received this vaccine, done so safely, and this event is still being identified, or the results that we have are kind of inconclusive. But again, trust and transparency require us to say, I don't know, when we don't know. These are my final points. Seek to understand before you seek to be understood. This is the key component of the two-way exchange of information that we talk about in risk communication and community engagement, right? It's listening and speaking. Build trust in everything you do. Every step of the way is a trust with every single stakeholder, with the public, with your colleagues, with everyone. It's so important, and work toward it every single day. Don't believe everything you hear. This is particularly on social media, don't believe everything you hear, but pay attention, be a critical thinker and a critical observer of the information that you have, and align it with your own integrity and with your trust that you want to have with others, and go from there. Cater to the heart and the head. When you're talking to people, you're speaking to their emotions, and you're also speaking to their thinking. And so you can appreciate their concerns, because maybe you're a parent and you have concerns about vaccination too, and you know that it's perfectly legitimate for someone to have concerns, and we share these concerns. And so, yeah, don't forget the heart. Cater to people that way too. Finally, remember that people want to know that you care before they care what you know. And so any communication, whether it's with your colleagues or with the public or community, these conversations about vaccines and COVID-19 and AEFIs, they all have to be informed by people thinking and knowing that you actually care about them, and that you care about what happens to them, and that you are in the line of work that you do because you care. Thank you so much, and all the best to you in your work. And it's been my pleasure to speak to you today.
Tara sa Vida Vaccination!